And by that, I would like to invite the other facilitator of today to give his speech, and it's Nicolai Schaaf. And Nicolai is a program officer at the Swedish Waterhouse, and he has been heading the cluster group program, and it has been I've been one of the participants, and it has been a really interesting and exciting journey, and to keep together the discussion in between all the stakeholders throughout the last year. And so please, Nicolai.
Thank you very much. Yes, indeed. An extremely interesting experience from us at SIWI and Swedish Waterhouse. This cluster group has been mentioned several times during the day, and I would now like to introduce and kind of rounding up the day by showing what we have done, since many of the presentations here today have been part of what has been discussed in our cluster group as well. But who are we? Who is SIWI, Stockholm International Water Institute? Torgny Holmgren, our executive director, gave a short introduction this morning. SIWI is a policy institute established in 1991, working under the vision of a water-wise world and all different aspects of where sustainable development and water meet each other. And if you think of water in the development context, usually you're facing these kind of situations. You have too much or too little water, or the water that you have is so heavily polluted that you can't use it or access it directly. So the access to clean water and sanitation, water governance and water integrity is one of our key issues, and then this famous nexus between water, energy and food production. SIWI is probably well known for the World Water Week and the Stockholm Water Prize. And I'd even like to mention this year's laureate, Professor Joan Rose from Michigan State University, because I haven't had any contact with her yet, but when I read about her, I thought that would be a very interesting contact, since she is an expert on public health and water quality and a microbiologist. So I think a lake in India where the only living organism is multi-resistant bacteria would be probably an interesting issue for her. And we at Swedish Waterhouse, we're part of SIWI that is responsible for stakeholder dialogue around international water issues in Sweden. We raise international water issues on the Swedish agenda and try to increase Swedish participation in these international processes. And we do this, amongst others, through these so-called cluster groups that are preliminary thematic stakeholder networks in areas where we think that there might be a specific Swedish position or contribution. And when we looked at pharmaceuticals, we quickly came to the conclusion that this is a very interesting topic for us. An ubiquitous or global pollutant that has biological effects, health risks, it's waterborne. That was our issue, and then additionally found that there are a lot of processes going on in Sweden that we could build on. And when we then invited to a first kickoff conference, we realized that there were many actors that had been working in this field for up to 20 years, but who commented then afterwards that that was very interesting. We all know each other, but we never talked together about environmental issues. So this is where we saw an added value, and after about a year of kickstarting dialogues and shaping the work and identifying priority issues, a cluster group or a stakeholder group around these members formed. And I think most of them are here today, not all of them actually, and most of them have even been speaking. LEAF, represented by Bengt, Stockholm's Läns Landsting, and the Stockholm County Council is that, and the public procurement aspects. Skeppalaverket, or Skeppalaförbundet, is a regional wastewater treatment company. big pharmaceutical chain, the Apotek Hjärtat, IVL, Swedish Environmental Research Institute, the academic hospital here in Uppsala, innovations and chemicals industry branch organization has been with us, and even Fresenius Kabi through the environmental working group within LEAF. And we've also been working closely integrated with a reference group where the relevant agencies, the Medical Products Agency, now I have to look on my list that I don't miss anyone, Swedish Water and Wastewater Association, the Ministry for Environment and Energy, National Agency for Public Procurement, which was interesting because that is a newly formed agency during the course of our work. Public procurement was earlier hosted at the Swedish Competition Authority. And through this work, as we've seen today, there's also been established a broader international cooperation, for example, with the SPHS Secretariat at UNDP and the SICAM chemicals approach, where pharmaceuticals have been raised to an emerging policy issue that has also been one of our most interesting international contacts. And before I run out of time later on, I want to take the chance now to really thank this network and these engaged people for their work. We at SIWI are not a pharmaceutical stakeholder, we're a water stakeholder, and we learned a lot during these 2 years. 1 year is a formal process, and with these 2 publications that you find outside, we have formally concluded our work, but at the same time we want to take these 2 days here, especially tomorrow, as a starting point as much as a concluding conference, and see how we go on with what we have. This is a starting point. We have a consensus among very different stakeholders, and now it's about to go on and take the next steps. But what have we done? The joint starting point was obviously that we think that there shouldn't be unacceptable releases throughout the pharmaceutical life cycle, and that's from manufacturing to the use to disposal. That's the common denominator. And what hasn't been mentioned as explicitly today, but I think it's obvious for everyone here, that this has to be done without putting patient health at risk at any time. That's a very obvious point as well. But at the same time, as we've seen today, there is no single quick fix. This is a very complex phenomenon, and there will be actions from very different stakeholders needed to get further in this problem. So during the work of the cluster group, we've identified 5 priority areas which have been covered today also. Production is obvious. Industrial effluent management as the key focal point, but we actually also want to go further and look into water, chemicals, energy efficiency in the future here. Second part, procurement, or to put it even broader, buyers, the market, who can put which criteria on pharmaceuticals when purchasing them. Then, of course, the consumption. And this is a rather broad issue, from how we use pharmaceuticals and why, and in which context and how we handle them, to then, of course, disposal and excretion. And I pointed these arrows then into the central, the core of everything when the pharmaceuticals end up in the environment, in the water bodies, where monitoring is, of course, crucial to be aware of what we're talking about. But then we also need to be aware of them. That's why the arrow in the upper left corner is in a different color. We're not necessarily talking about the same environment, not the same water body. From the Swedish perspective, excretion, like Joachim earlier said today, is of course the main problem compared to production. In other parts of the world, the picture is completely different. We need to be aware of that. Now that everything looks a bit the same, with the same colors and the same arrows. And I'm now going to go quickly through the different chapters that we've been working in. But basically, I'm happy to see that everything we came up with has been said earlier. And in many areas, especially wastewater treatment and the monitoring, we said we can support existing positions. We don't need to reinvent the wheel. There's a lot going on. So this was rather an issue where we did some summarizing of ongoing work, but especially production and procurement and the question of how and why do we use pharmaceuticals were the key areas. Eco-pharmaca stewardship, we've heard about that. One of the key pillars is discharges from production, the effluent management. There is the model suggested based on predicted environmental concentration that needs to be lower than the predicted no effect concentration. Simple, down to earth, and a good starting point as we see, but as I indicated earlier, there is options to think a bit further of that. And it requires that companies apply state-of-the-art wastewater treatment to ensure that there are no problematic effluent concentrations. We've heard about a project where the over-the-counter products might go through a test of this model. That will be very interesting to learn from that and to identify the possibilities to apply that also in the prescription market, because then we might approach a problem that is specific for Sweden, but I'm sure there are comparable problems in other countries, where we have an incentive through the generic substitution system that basically focuses on cheapest available product wins. And there we said in many political debates that we can't have a incentive structure in the health system that violates many of the environmental objectives that we have mentioned earlier today, and it violates the political coherence for sustainable development in many cases. There is also a need for a business case. How can we earn money on this? And there is a lot of experience to be gained. There are ideas that Sweden could be a pilot market for these sustainability tests, but we're not there yet. This is an ongoing debate, but we're very curious about tests, and we've seen pharmacies trying to label in the shelves, but still there are no criteria for it, so we don't really know what their labeling is based on. So this is very interesting and very dynamic right now. In the end, the industry needs to provide information that can reply to the requests from the purchasing or procurement tools that the buyers have. If they want to get information to make an informed decision, they need to get that information. And additionally, one of the key areas should, of course, be antimicrobial resistance. But as we've seen, different groups can lead to very different challenges. Sustainable procurement, I can do that a bit more quickly since we've heard very much about that. But interesting is the relation between the market share that might not be that big, but the normative authority that the public sector has, and also the mandate or the requirement to fulfill national political sustainability policy. Public actors have no choice. They have to do that. But even private actors would be interested in that, and I believe even the industry would be interested in having harmonized criteria about the different potential buyers to be confronted with less audits, with less questionnaires, and not every single procurer coming up with their own set of criteria. So the ongoing debates within the industry are of course also very interesting, like the Pharmaceutical Supply Chain Initiative. We need that dialogue, and that's not only within Sweden, that's within Europe, across the globe, between public and private. And as I said, this problem with the generic substitution system is a kind of handicap for the pharmacies to act as a market player, because they cannot come around that system. So they need an operating place to get further, and that's why the over-the-counter market might be an interesting starting point. We suggest a national platform that might be hosted by this by the new procurement agency, because we believe that a common host, a common platform will serve this debate a lot. General upstream measures. means that it has been mentioned several times here that within the health sector we need different tools, we need to make an informed choice, but where are these choices actually? And this is where we come back to the dialogue with the industry and the access to information to be able to make an informed choice. But on the other hand, how can we reduce or at least optimize the total consumption? There have been different ideas mentioned for that. How about physical activity on prescription? It doesn't necessarily need to be pharmaceuticals we need. Very practical is to optimize the size of start packages for first-time users. Before you get a permanent treatment, you might end up getting a huge package. You find out that it doesn't work for you, and no, it's prohibited that anyone else could then use this medicine later on, so it has to be thrown away. This also would be potentially an interesting role, more of an advisor than they even have today for the pharmacies, to help consumers find their niche, and not only to say paracetamol or ibuprofen, or which paracetamol or which ibuprofen, but also, do you really need that? I think that would be one of the key questions that could be placed on the upstream side. Downstream, we've heard a lot, of course, today. Wastewater treatment is kind of niched in between opposing interests, between environmental objectives. You don't, without need, want to increase the energy consumption. It's expensive. You need to find the right prioritization. At the same time, we've seen that there is a lot of technology available. My summary was always, okay, if we want to, we know what to do. And of course, there's a lot of research still going on. And we heard that it's important to think before you act. But I think there is no... I'm sorry, I forgot to click on. There is no lack of information to take the next steps. But when it then comes to the recipient, of course, monitoring is one of the crucial issues. And there's some work been going on within Sweden, and we think there was a study showing that the data available is somehow good, but a lot of data is not good and is not usable for a systematic monitoring. So we need to take that on a different level. There's been a suggestion on 22 substances based on legal requirements and the EU requirement, what we need to monitor, based on what we have information about in Sweden, and based on an own Swedish-based information about the top-selling products, what are the largest volumes, what are the substances at risk. So we as a cluster group support this list that has been produced in the context of the pharmaceutical strategy, and we hope that the Environmental Protection Agency will then be able to take up this list and ensure that this becomes a systematic monitoring. So just as an outlook, the next steps for us will be to take these recommendations, discuss with these stakeholders and the broader network, whoever is interested. Now it's an open process again. How do we go on with this? We have suggestions for a pilot project where we can test all our recommendations in a setup with the relevant stakeholders on a more geographically restricted area. One other key area for us will be the procurement, to be able to link the industry perspective and the buyer's perspective to come up with practical, stringent, and transparent and applicable criteria. I think this is one of the key dialogues that will be in front of us. And then, of course, to continue, especially the Swedish dialogue about the incentives and the framework that are put on the pharmaceuticals market. Thank you very much.
Thank you very much. Bye. And I can really recommend you to visit the workshop tomorrow, where we'll have more discussions about the next step. As I told you, I think this cluster group work has been extremely useful, and it has broadened the perspective for most of us. I think having these this process going on for almost a year. Okay, we have room for one question. In mind, do you have any next step for the as the cluster group? Now we have some outcomes to go further on with, but is there any thoughts about a continuous cluster group?
Well, yes or no, and as I said, the process is of course open for everyone to join, and what we want to discuss with the members, of course, is who is willing to go on. It's as open as voluntarily. So I hope we'll get a feeling for that tomorrow, how far or which role SIWI is expected to play further on. We'd of course like to be the host for this dialogue further on, and I think we have several project ideas and several topics to cover where we feel that there is an interest to continue in that. But that would be SIWI in this role of a facilitator and linking the Swedish actors to the international arena.
Yeah. Okay. Many thanks, Nicolai.